Hi, I'm Mr. Shanmugasundaram Rajkumar. I'm a consultant trauma and orthopedic surgeon based at Circle Rossall Hospital in Glasgow. I subspecialize in hip and knee surgeries and replacements and knee arthroscopic surgery. I chose hip and knee surgery because it combines the things I find most rewarding about orthopedic surgery. Solving problems, restoring function, and making a tangible difference to people's quality of life. I particularly enjoy the balance between the technical aspects of the surgery and the practical aspects of the specialty. Although hip and knee conditions are very common, but every patient is different. So getting a good outcome requires careful assessment of the patient, um, sound judgment, and attention to detail. Um, I find it very rewarding when I see patients regain their mobility and independence and able to do the things which they enjoy after the surgery. What I find most rewarding about being an orthopedic surgeon is seeing the real difference I make to someone's life. This is something very satisfying to see, helping a patient who has been living with pain and difficulty mobilizing and being restricted at home, and they return back to regaining their independence and return to their activity they enjoy. Ultimately, this gives me great satisfaction from seeing these people walk better, feel better, and regain the confidence and quality of life. Knowing that I have played a part in this transformation makes my job so fulfilling. I think my patients value most is that I listen to them, take the time to understand what is important to them, and give them honest and straightforward advice. I try to make them feel that they've been treated as an individual rather than a symptom or a diagnosis. What this, I believe, is because of my calm and approachable manner and the fact I'm committed to achieving the best possible outcome for them and improve their quality of life. It's the trust they place on me. Each patient have their own expectations, story, and goals, and I really value the opportunity they give me to understand these and help them get back to the life they want to lead, which I feel is what I value most about my patients. One of the biggest challenges in hip and knee surgery is that every patient is different. Although the procedures are common, patients have different expectations, lifestyles, medical conditions, and level of disability. So it's very difficult. There's rarely one size fits all approach in hip and knee surgery. This also gives a significant responsibility on my side in deciding whether surgery is appropriate for them and equally whether it is not. So managing the expectations of patients and ensuring that patients have a realistic understanding of what surgery can achieve is an important part of my role. Yes, I do. Do what is right for the patient is my simplest way of describing my approach to orthopedic surgery. I believe in listening to the patients, understanding what matters to them, and giving honest advice and recommending treatment that I genuinely believe is in their best interests, whether that means they have surgery or not. For me personally, a good surgery is not just about performing the operation well, it's about making the right decision for the right patient at the right time.